There are some concerns when using drugs for heart failure. Cough and angioedema are concerns about ACE inhibitors. However, decades of trials show that they reduce mortality and hospitalizations and remain effective when ARNIs are not suitable. There are concerns about whether ARBs offer the same benefit as ACE inhibitors or ARNIs, but strong evidence shows they improve symptoms and reduce hospitalizations when ACE inhibitors cannot be used. Beta blockers may briefly worsen symptoms if started when the patient is unstable, but evidence shows that carvedilol, bisoprolol, and metoprolol succinate significantly improve survival and reduce arrhythmias once the patient is clinically stable. Diuretics do not improve long-term survival and can affect kidney function, but they have strong evidence for rapid relief of congestion, improved breathing, and reduced admissions, making them essential for symptom control. Mineralocorticoid receptor antagonists carry a risk of high potassium, especially in reduced kidney function, but major studies show they significantly reduce mortality and hospitalizations when patients are monitored carefully. SGLT2 inhibitors were initially controversial because they were diabetes drugs, but recent trials show they reduce death and hospitalizations in heart failure patients with or without diabetes, so they are now guideline recommended. There are questions about race-specific recommendations and adherence issues with hydralazine isosorbide, but strong evidence shows clear survival benefits in some patients with HFrEF and usefulness when ACE inhibitors or ARNIs cannot be used. Digoxin is debated due to toxicity and mixed mortality data, but when kept within low therapeutic levels, evidence shows it reduces hospitalizations and helps with symptom and rate control, especially in atrial fibrillation. There are also concerns about ARNIs in relation to angioedema and cost, but evidence shows they reduce cardiovascular death and heart failure admissions more than ACE inhibitors, making them first line for many patients. For nurses, all of this means that medication safety, monitoring, and education are critical. They must monitor for predictable risks like low blood pressure, kidney changes, slow heart rate, electrolyte imbalances, or early side effects, because good monitoring keeps these drugs safe and effective. Nurses need to know which drugs improve survival and which control symptoms so they can explain the purpose of each medication and support adherence. Finally, nurses advocate for patients regarding access to effective medications and provide ongoing teaching about safe use, side effects to report, and the importance of follow-up and monitoring.